Hi, I'm Dr. Tony Mork. I'm lucky today to have Dr. Dan McClure here to ask him a few questions about chiropractic and what he does when chiropractic may not be sufficient to treat some of the problems he's faced with. Anyway, well, Dan, it's really nice to be with you today, and I know that you've treated thousands of patients over the years, and as a seasoned chiropractor, I would like to know if there's any particular problems that, for one reason or another, don't always respond to chiropractic over a period of time.
That's a good question. Many of the things that are presented in the practice, what I found over the years with those thousands of patients, varying degrees of response. And it's really been based on experience. But there are certain things in particular that really don't respond well to chiropractic. Those in particular would be like some really chronic sacroiliac type issues, some musculoskeletal issues where there's tears within the substance of the sacroiliac ligament. If we have severe degeneration of a facet, perhaps, that makes it very difficult to treat. Any type of really progressive neurologic deficits in the upper extremities or lower extremities tend to at times not respond favorably.
Okay, so when you have patients that may not be responding to a certain therapy regimen, do you have a time limit that you will treat them if they're not progressing, or how do you figure out what the timeline is?
I think it's another really good question, and part of that I think is really based on experience and seeing many of these conditions over time. Having a pretty good understanding of the anatomy, seeing the MRIs and seeing what's going on. Historically in my practice, realistically, within 4 to 6 treatments, if the patients really aren't responding and there is some neurological issues, that's when I have a tendency to start thinking about other possibilities and consider making referrals and recommendations for additional studies at that point in time.
When people are not progressing and maybe experiencing some kind of neurological problem, I mean, do you order any studies, or what do you do next with that situation, or what do you like to do?
Traditionally, part of it is, again, being a seasoned practitioner, you kind of get a sense of when things aren't going right. So I will, if I don't have any advanced studies, I will absolutely order some advanced imaging at that point in time, possibly EMGs or nerve conduction studies. And if then, once I get that information back to me, then I'll make selective referrals based on that. Whether patients have the ability in my area have to stay local due to financial constraints or insurance issues, or if I can possibly send them out to see you, which I've done a lot, that's my usual progression.
So, of the patients you've seen, have you noticed any difference in the type of surgical treatment that they may have had either before or after you've treated them?
Absolutely. I see different variations depending on the type of treatment the patient has, be it injections or a surgical intervention, whether it be a minimally invasive approach or a full-on fusion type approach. Generally, the first two I see get referred to me very quickly after the procedures. Most of the surgeons in my area that do the fusions, I typically won't see that patient. It might be a year or two before it returns to my office.
When we met many years ago, I mean, it was really on a medical basis, and you actually had a significant disc herniation in your back. And I was just going to ask you what your experience was in terms of, working and then not working and then having an operation and then getting back to work, using the, kind of the really endoscopic or really ultra minimally invasive kind of techniques that we were using at that time.
Well, as you know, it's been about 10 years since we really did the first procedure. I had ruptured L4, L5 on the left side, and had basically spent a year searching for a non-fusion type approach, and that's when I had stumbled upon you and made the trek across the country to see you. And at that point in time, you did the minimally invasive approach, and you basically gave me my life back. At that point in time, you basically told me not to go back to work in about 12 weeks, and I went back to work in about 6 days. And really have had minimal problems with that particular level since. And as you know, I ruptured a disc in my neck about 6 years ago, which I didn't wait a year, and I did come see right away, which you corrected that issue. And those results have lasted to this point in time, to the point where, as you know in your practice as well, I have just referred many patients to you specifically because of the results that I had from the endoscopic approach.
Well, Dan, I've really enjoyed working with you over the years, and I don't think it's that typical for chiropractors and orthopedic surgeons to team up together for the benefit of the patients. And I don't know, what do you think about that?
You know, Tony, I'm absolutely in agreement with you. I think the allegiance that we've made has just benefited so many of our patients over time. And those relationships that I've made with a few of my local orthopedists have significantly helped my practice, my patients. And I wouldn't be able to do that without that team concept. And I think that we should we've set a really good precedent, and hopefully that many other people that are out there practicing will be able to do the same thing and put down any egos aside and just get together for the benefit of their patient, and also the mutual relationship gained between the practitioners.
Well, Dan, I really enjoyed talking to you today, and it's been always great working with you. Thank you very much.
Good to see you as always. Thank you.